So tonight's topic is the secret to optimum health and wellness. And I'll tell you a little bit about me. My name is Dr. Barry Weinberg. I'm a chiropractor. I've been in practice since 1994. This is my 21st year in practice. And when I got out of school, I had a vision of a place where people can go to heal themselves, a safe environment that kind of broke the rules of what a doctor's office should be like. There's no waiting. There's no desk you walk up to. Just someplace very comfortable, very warm, and very safe and healthy environment to heal. Along the way, I've written a couple books. I'm an author, A Clear Path to Healing, Reclaiming the Inner Healing Power of Body and Mind to Reach Your Optimum Health Potential and to Face a Dragon. And I'm also a musician. I'm a guitar player and a songwriter. And a few years back, I had the opportunity to write the soundtrack for Florida Crackers, a documentary film about the cattlemen and cowboys of Florida. And you can actually watch that for free at floridacrackersmovie.com. So there's my plug about Florida Crackers, and let's get started. So this is my favorite quote in the world. I live by this quote: be the change you wish to see in the world. I'm going to be sharing some information tonight that might be a little disturbing. Some people, when they hear it, are going to say, no, that can't be true, and they're going to discard it. Please, if you're one of those, go online and look it up for yourself. These are statistics from the AMA and from different the World Health Organization, the CDC, Center for Disease Control. These are legitimate stats. There are others who are going to read it and get very angry and want to do something about it. Well, to take on what I'm going to be sharing with you is a big task. So my suggestion right from the beginning is, if you're one of those, is to be the change you wish to see in the world. How can you change it in your own life? How can you be more of it in your own life and share it with your family and friends? And if enough people who did that, the bigger picture would change. So with that said, when it comes to your health, do you ever feel like you're chasing your tail? Maybe you have a health condition and you go from doctor to doctor, therapy to therapy, medication to medication, and things don't seem to change. Or you want to lose weight and you go from this diet to that diet to that diet, and the weight goes off and the weight comes back on, and you just feel like you're chasing your tail. Well, we all know the definition of insanity: doing the same thing over and over, expecting different results. So tonight, I'm going to be sharing with you a little bit about the healthcare crisis in our healthcare system. Our healthcare system as it is today. And this is the part that's going to be shocking. And I'm going to offer some solutions so that you can break free of this cycle of chasing your tail. So let's get started with that and jump right into it. Just so you know, I have these webinars designed to be about 30 minutes. I don't want it to be a long, drawn-out thing. I want to give you a tidbit of information each week that you can take into your life and apply. Not a whole bunch of information, you take one little piece out of it and you don't apply even that. So each week I'm going to be doing this, and I'm going to be giving just a little bit of information. Then I'll build on it each week. So let's look at this healthcare crisis. What is the healthcare crisis? The healthcare crisis is escalating healthcare costs with more and more people getting sick and suffering from disease. This is really the problem. And the challenge is that they feel the solution is financial. Obamacare, more insurance, changing, people are fighting to get pharmaceuticals to be cheaper. But you're going to see tonight that that's not really the problem. And to try and fix it with the financial system is not ever going to change the problem. The system itself needs to change. So let's look at some of these statistics directly from the Journal of the American Medical Association. Now, I actually put this slide together as a projected slide back in 1999. So I'm comparing the statistics that I found back in 1999 compared to last year, 2014. So first of all, In 1999, America spent over $1.2 trillion on healthcare. I looked it up, and 2014 was $3.8 trillion. We spent 3 times more. That's a lot of money. I'm sure you all agree. Now, the challenge with this is that if you take the next top 10 spenders, Germany, England, Japan, France, can't name them all, and total them, we still spend more than them per capita altogether, which is pretty profound. In 2000, we spent all this money on healthcare, yet in 2000, America was the 24th healthiest of the World Health Organizations. 2014, we were the 29th. Spending 3 times the money, and we went down. This is not good. In 2014, the U.S. ranked 44th in overall health system performance, putting it between Dominican Republic, which was 43rd, and Bulgaria, which was 45th. I have you all on mute, but I'm sure you all just went, that's crazy. By the way, number 1 is Japan. And the difference between us and them is the U.S. waits for us the majority of our healthcare system waits for us to get sick and then treats the illness. Where in Japan, people go to the doctor to learn how to be healthy and well and how to live a healthy lifestyle. So they're not treating much disease. The word doctor means to be a teacher. And that's what doctors should be. To teach you how to stay healthy, not wait for you to get sick and then sell you a bunch of stuff to kind of manage you at status quo. Now, I just want to put in here that I am not a basher of medicine. These are the statistics. These are the facts. I'm just presenting to you what is. And if I get hit by a car and I'm bleeding, don't take me to my chiropractor. Take me to the ER. That's what medicine is for. Medicine is there to save us in times of when our life is at risk. But medicine, pharmaceuticals, surgery shouldn't be a lifestyle. I think you would agree with that. And that's what it's become. People walking around with bags of pills. So let's keep going. Remember, there's a chat button on the bottom. If you have any questions or comments, put them in there, and at the end, we'll look at it. Chronic disease is the #1 killer in the United States, accounting for about 4 out of 5 deaths in America each year. About 100 million Americans, more than 1/3 of the population. Now, this is the scary part. Current reports by the AMA and the Journal for Patient Safety reveal the following reported deaths. 12,000 deaths per year from unnecessary surgery. 7,000 deaths per year from medication errors in hospitals. 20,000 deaths per year from other errors in hospitals. 80,000 deaths per year from nosocomial infections in hospitals. Nosocomial means infections that were caught in the hospital. 106,000 deaths per year from non-error adverse effects of medications. You total this up, and that's 225,000 preventable deaths due to adverse effects of medical care, making this the 3rd leading cause of death in the country after heart disease and stroke. Whoa. Why isn't anything being done about this? There's a lot being talked about gun control. There's a lot being talked about illegal drugs, especially marijuana. Now let's compare this. Let's look at this. In 2014, there were 12,564 gun deaths. Okay, that's a lot less than this number, 225,000. There were 17,000 combined illegal drug deaths, 0 marijuana deaths in 2014 reported. I think our attention is on the wrong thing. It's not that medical care needs to go away. We need it, but something needs to be done. And that something needs to be done is all of our own responsibility, which is to take care of ourselves so we don't need it. Why is it that we spend more money than any other nation, yet we're one of the sickest? Now, like I said earlier, a lot of people say it's because of the money. We have to fix our healthcare system through a new insurance system, Obamacare, or we need to lower healthcare costs by cutting the cost of pharmaceuticals. I don't believe that's it. So the old supply and demand. If there's a demand, the price is going to go up. If there's a low demand, price is going to go down. I believe the causes of the healthcare system are not financial. I believe it's just an obsolete healthcare model, and that there's a lack of responsibility on behalf of the participants. Now, when I say responsibility, there's more than one meaning to that. There's the traditional meaning of responsibility, which is being able to take effective action to get something done. But you see, I split the word, responsibility. It is my belief, and I have a lot of research to back it up, that the cause of disease is one thing: the body's inability to effectively adapt to and recover from life's physical, emotional, and chemical stresses. I went to school for biology. I was a biology major, and they emphasized that life thrives when it's able to adapt. It's the same with us. The more effective we are able to adapt, the healthier we are. So when I say responsibility, your body's ability to respond effectively to life and stress. So if we can shift our healthcare system, not financially, but the fundamental beliefs and philosophy and core values that make it up, and increase our body's ability to respond effectively to stress. So the beliefs that our current healthcare model have are: 1, the body makes mistakes. 2, healing comes from the outside, meaning a doctor, a therapy, a drug, something. We get disease from the outside. It's the germ. It's the smoke. It's whatever it is that's out there that gets us. Okay, this is our current healthcare model. Germs and toxins are the cause of disease. Symptoms are bad. Health equals no symptoms. People are powerless to help themselves. These are myths. This is not healthcare. This is disease care. And like I said earlier, it's sometimes needed, but it's not it shouldn't be your lifestyle. True healthcare is different. And oh, I found this. I thought I'd throw this in there. I thought this was great. I don't think I need to explain that at all. Thought I'd give you a little laugh. So here's a solution, which I call a clear path to healing. I wrote a whole book about this. New model of health and healthcare, increased responsibility. The growing wellness model. The body is not stupid and doesn't make mistakes. It is an intelligent, perfectly coordinated, self-healing organism. That all healing comes from within. Even if you take a medication, it's your body that utilizes it. Even if you have a surgery, it's your body that heals it afterwards. Healing, you cut your finger, the scab comes. You break a bone, the bone mends. Healing comes from within. Disease is created from within. It's not the germ or the toxin. It's how our body responds or doesn't respond to that germ or toxin that makes us sick. That's why people in the Red Cross that work around people with tuberculosis don't get tuberculosis. You ever wonder about that? Nurses out in Africa that can help these people, they don't get disease of the people that they're working with. We have a whole class of kids that get sick, but 1 or 2 don't. Their immune system is strong, and they're able to respond appropriately to whatever vector is out there that's in the environment. Disease is caused by our inability to respond appropriately to germs, toxins, and stress. I just mentioned that. Symptoms are not bad. They are agents of change. And next week, that's what the entire webinar is going to be about how every symptom, and we're going to go through them, is actually an agent of change that heals us. A symptom is the body's ability to respond appropriately. It's the body adapting. You have a fever, it is the body raising the temperature because viruses and germs don't like that. and it's cooking them out. Vomiting, diarrhea, it's stuff getting out that shouldn't be there. Pain is the body saying, hey, get that nail out of your foot. It's not your enemy, it's your friend, it's your guide, it's your teacher. Health is the result of full expression of life and wholeness, not the absence of symptoms. Very often, symptoms mean you are very healthy. In fact, if you didn't have very much of our symptoms, very often you would die. The symptoms keep you alive. People are powerful, creative beings capable of healing themselves. You really don't need anything outside of yourself unless it's a very severe life or death situation, like getting your arm chopped off, or you go to Africa and you don't have immunity to malaria and you get malaria. You know, these kind of things do happen, and that's where doctors excel. That's where medical doctors excel, and that's why we need them. But the true healer is within. I believe these are truths. And this is true healthcare. So shift. What can you do? Be the change you want to be in the world. Step one is shift your beliefs. If you want to take a picture of this page, that's why I put it up here, because I'm not going to read through it again. Shift from the disease model to the wellness model. See if you can shift your beliefs from the left side to the right side. Start reminding yourself of this all the time. Healing comes from within me. I heal myself. I am a powerful, creative being capable of healing myself. I have a symptom. What's my body trying to do, and how can I support it? So my suggestion, if you have a phone, take a picture of this page and remind yourself of the things on the right. And when you find yourself on the left, find the corresponding one on the right. But there are other things you can do. This is what I call the 7 responsibilities. I outline them in the book, A Clear Path to Healing, and I'm going to have a webinar on each of them in the future. I'm just going to go through them really quickly. First, I think is the most important is to be present and aware. This usually results in some form of meditation, and learning and having some kind of discipline to stay present and aware takes a lot of stress out of life. Instead of worrying about the future and always thinking about the past, get present, be aware, find some form of meditation. Something that I do in my personal life is called the self-discovery techniques. And if you'd like to learn more about that, you can call me at the office or send me an email and I can forward you to that. Vital food and drink. This is easier than you think. I have 2 rules in my own life. I look at ingredients, and if I see anything on there that doesn't sound like a food or I don't recognize, I don't eat it. If I see blue number 6, that doesn't sound like a food. I don't eat that. If I see apples, oranges, honey, that sounds like food, I'll eat that. And drink, most important thing is water. Half your body weight in ounces a day is what your body requires. I'm guilty of not always doing that, but it is what's important, and it is something that can de-stress the body. So if you're 180 pounds, if you're a guy, 110 if you're a girl, cut that in half, and that's how many ounces you need a day. Proper exercise, just do something. A little bit of something's better than a lot of nothing. Go for a walk. If you like to go to the gym, great. If you like to bike, great. Swim. Just get your body moving at least 10, 15, 20 minutes a day. I have a 10-year-old son there, so it's really easy for me because he gets me to play and do things with him. Active breathing. Take some time each day to just... You can do that while you're being present and aware. Adequate rest. Are you sleeping well? If not, you got to give my wife Anya a call at our office. She's an expert on that and can support you in that. A loving heart. Give. I just joined the Rotary Club. Doing charity work out in the community is so healing, and it just feels so good to do things not for me, just to be out there. And in my own life, since I'm 9 years old, I've been getting adjusted by a chiropractor, and I'm of the belief as a chiropractor, I'm biased, that in order to be able to be effective in all these things, you need to have a clear, healthy spine and nervous system. I'm not biased and say that because I'm a chiropractor. I'm a chiropractor because I believe that, and that's how I was brought up as a kid. My parents took me to a chiropractor as a kid. I really didn't have much medicine growing up. My parents, if I got sick, took me to get adjusted. My son Daniel's the same way. He's never had medicine. He's 10 years old. He gets his colds, but he gets over it quickly because we keep his spine nice and healthy. So I practice something called network spinal analysis. It's a gentle form of chiropractic care that actually focuses on the body's ability to adapt to stress. These are some of the benefits that people have reported out of research that they did at the University of California Medical School. You can read over that. And you can see it's not just the typical physical pain like most chiropractors. People come to us for depression, anxiety, blood pressure, stress-related things, which really, in my view, is everything. We use gentle touches on the spine to help the body learn to, one, recover from the past stresses that it's already experienced. Two, develop more effective adaptive strategies so that if you experience stress again in the future, you have a more effective strategy to deal with it. And three, let's optimize the nervous system. Let's get the nervous system functioning the way it's supposed to. We get great results. I've been doing this 21 years, and people see unbelievable results. It's really effective. I'm not going to read through this. You can browse. In our office, we can actually measure the stress in your body. This is a muscle scan that we do. On the left, wherever you see colors was areas of muscle tension. Green is mild, blue is moderate, red is severe. After about 3 months of care, this was the person, and they were doing much better, as you can see. This is a thermography that measures spinal cord and nerve stress. You can see they had some severe nerve tension at C3, 4, and 5. Also, after a few months, you can see this is a perfect scan down here at the bottom. So, as a token of our appreciation for being here tonight, if anybody's never been to my office, you and your family can come for a $10 donation to a local charity that we're going to give, and we'll do a thorough examination, give you recommendations. And if you want to come this week, we're actually having Frankenstein week. We're actually giving 5% off. We do prepaid plans. We have different payment plans. You're getting 5% off that as well. So there's our little plug. Next week, making friends with your symptoms. Discover how symptoms are activating mechanisms of healing and how to use them to reach your health goals. So I'm going back to this. You got some information tonight that's a little shocking. I gave you some suggestions, not a lot of detail, but some suggestions how you can be the change you wish to see in the world. So what I'm going to do right now, I thank you for listening. I'm going to take it off this mute. Let me see if I can figure out how to do this. Unmute all. And if there were no chats, so I'm going to close that. So if anybody has any comments, questions, go ahead.
Can you hear me, Dr. Berry?
Yes, who's this speaking?
Julie.
Hey, Julie, how are you?
I'm good. How are you?
Let me get rid of this. If you want people to see you, you can block your picture. Can you guys see me?
I can see you, but I prefer you not
I'm not
put me on there.
No, you got it.
I just want to say thank you. I enjoyed it very much, and you've given me a lot to think about. And so thank you. You did a good job.
No, I'm glad. Will we see you next week?
Yeah, Friday, actually.
Okay. No, I mean at our webinar.
Oh, yes, of course.
Okay, great. Great. And if you want to look at it up, there's a lot more information online if you really want to dig into it. It's the question that comes up for me is, yeah, gun control is important, and that stuff's going on. When you see the difference between 12,000 deaths and 225,000 deaths, why aren't people speaking up about that? It's crazy. Why isn't something being done? Hippocratic oath, first do no harm. Chiropractic last year had no deaths. Acupuncturists had no deaths. Marijuana had no deaths. So where's our attention and what's really important?
Well, I think that a lot of people don't know about chiropractic, and they don't understand it. And I think there are times when you just have to you search all the time, and you try to find something that works for you. And this has worked for me, especially the format that you use with network chiropractic. It has worked for me a lot, and I think that many normal internists and general, I said gen ed because I'm a teacher, general doctors, general practitioners don't get it. They don't get it because their focus is completely different than what you're trying to do.
Well, yeah, I agree with that. I don't know if anybody can hear me, but that focus on pharmaceuticals is really big.
Good to hear your voice, George.
Thanks. You too, Barry. Yeah, it's all about the pharmaceuticals. You know, people see a lot of television, and that TV tells them, go and ask your doctor about this. Go and ask your doctor about that. And so many people are really looking for a quick way rather than maybe let's explore a little bit more of how powerful our bodies really are. Being somebody who's used chiropractic for years, you know, I know my body is so powerful and can do so much to take care of itself.
You know, I have two things to say about that. One is pharmaceuticals aren't a quick fix because you usually have to stay on them the rest of your life. Right,
that's the plan. Exactly, and that's a plan. I agree.
And the other thing is, you know, the pharmaceutical companies have a lot of financial backing, they have a lot of governmental backing, and they have a lot of money they could put behind that. For most chiropractors, acupuncturists, people, you know, we're private practice people that you know have our small businesses, and we don't have that kind of backing to put those kind of commercials on to say, hey people, you know, and share information like I shared tonight. So we got to do it a little more grassroots and talk to people out in the streets and have them talk to people, and you know, it's a whole totally different experience. You know, if we had some of that financial backing behind us, we could shift this healthcare system a lot quicker.
Well, you'll just have to sell pharmaceuticals. That's the only way. That's the way the game is played.
That's not going to happen.
I think we all know, right? Exactly. We all know they pay for their vacations and all that stuff in the name of you know, continuing ed and stuff. It's all bought and sold by AstraZeneca and all those guys. I mean, that's the deal.
And well, I think. Hello, this is Anya.
Hi, Anya.
Anya Weinberg. Hey, everybody.
Hi, Anya.
Hey, everybody. I think as individuals and as moms and people that maybe have families, if all of us would take a stand and just pick and choose something that we truly feel is right for our family. Now, I know we've raised our son. He's 10 years old. He's never been on antibiotics. He's never taken medications, and he's probably one of the healthiest people that I know. And sometimes it comes with the choices that we make. You know, it's not only the type of food that we eat, but also the attention that we put around food, around just being, you know, some people call it mindful, but I just call it being present when you cook, when you eat. And I know, George, you're a big believer of this type of stuff as well. And Julie, we have had conversations in the office. You know, it's taking care of all of us, the body, the mind, the spirit. And as we do that individually, you know, yes, I would love to tell you that I would try to get all the commercials banned that are about pharmaceuticals on TV because I think they're ridiculous. I mean, have you ever felt blue? Yes, you're a human being. Sometimes you're supposed to feel blue, you know. And but I think as we empower each other and say, hey, I have found this helpful, and as we empower other families around us and other individuals, you know, then all of a sudden we're becoming a force that can't really be bought by a commercial on TV.
Amen. Yeah,
you know, and I think that's how we're going to make the change. Educating, doing what we do, give it out to the communities, empower people around in our world.
And those commercials that we see here are only in America.
Oh yeah.
You go to Europe, you're not going to see that.
No. Well, my understanding is abroad, their focus is on when doctors encourage a certain number of patients to quit smoking, that's when they receive bonuses. You know, it's always it's toward preventive, not towards how much can I push. And it's big. Like for me, my biggest shift, I don't know if you've seen my photos over the last 2 years, but my biggest shift was not only learning to appreciate each bite and appreciate each meal, but just changing nutrition and the amount of hydration. I didn't even realize how dehydrated I was. And when I started hydrating properly, I realized I wasn't as hungry as I thought. And the weight just started falling off. I mean, I eat so much better now. And nutrition changed everything. Stretching, nutrition, exercise. My standing weight, I'm 6 feet tall and I weigh about 164 pounds most days.
Wow.
Good for you, George. That's awesome.
It is. It's crazy.
And it's funny because here in America, oftentimes we're so unfamiliar with the feeling of what thirst feels like that we actually think we're hungry.
Amen.
And most of the time, you know, when I'm a slow eater to begin with, but I love to eat food. But the amount of food that our family eats, normal people would probably be heavy on. Because yes, we look at the ingredients, we eat real food. I'm a big believer into real things, real food. And you know, if you hydrate well, you get the exercise. We all, you know, we don't only have a husband and a dad that is a chiropractor, but we are perfect clients ourselves. You know, we apply this type of stuff in our life as well.
Yep, it's a piece of everything. And I wish people were a little more interested in the real ways. Like if you really think about how like most people you see now are like 15 pounds overweight or more, and that really, like when we were kids and growing up, seeing a heavy person was a rarity, and now it's so common. And it's just like people aren't putting the pieces together. And it's very simple stuff. Very simple.
Okay, any other comments or any questions?
No, it's time for a snack.
Thank you. This was really awesome.
Yeah, it was great. I'll see you next Tuesday, definitely.
So we'll be doing this every week. Spread the word.